अस्सलाम वालेकुम मोहतरम नाजरीन उम्मीद छ तुह ٲسِو बखैर आफियत पेंड ऑनलाइन पूरे टीम तरफ वात तुह सन सलाम तो दुआ यथ कन जन तुह पाई छो पतम कह टाइम पे लगभग रेत अलाव पे करान सोन फोकस वनकस रोजान टोटल ड्रग डी एडिक्शन क्योंकि वचान कि मज कह प्रॉब्लम फैलम पतम हफ्त लास्ट सेशन तथ मज करे कत अकिस एस्पेक्टस पे कि वो यह रूहानी एस्पेक्ट ड्रग एडिक्शन अगर अम नश नजात हासिल कर टोटल मेडिसिन योतन वुन कि क्योंकि अत अंदर तह एस्पेक्ट्स तो तथ खतर अनमित जो एक्सपर्ट ब्राइस बाम तो बे ग्रेगरी वलीद खवलक यमो कत कर फ्रॉम देयर एक्सपीरियंस या तिहद इदार तरफ कित तम कह पॉइंट्स या प्रोग्राम्स दिवान लुकन यम तुह तम वातनच तह कोशिश कर इंशाल्लाह तमिक उर्दू तो कशिर तर्जुम तम तह लगभग तैयार कर्मित यम तुह तम वातनो अहम इशू ओत्र द्राव सह कि ड्रग एडिक्शन कत कर यह टोटल मैनिफेस्टेशन ड्रग एडिक्शन प्रॉब्लम प्रॉब्लम जहनी तो रूहानी यह जहनी तो रूहानी परेशानी या प्रॉब्लम इंसान इन ओत्ताम वातनावान सो बड़ चीज मज वचान जो पहलू पे नेरान कि गरो मज सैनिस माहौलस मज सैनिस माशरस मज प्रॉब्लम वचान यम सितम वचान या यम यम त हिसाब सह इजतराब वचान सह अत कुन वातनावान ड्रग एडिक्शनस कुन वारियाहन लुकन या ड्रग एडिक्शन गसान दिस इन टर्न अम सोसाइटी मज यूता असर पेवान कि डोमेस्टिक वायलेंस या बाकी चीज सान गरन अंदर अमुक असर वातान गो यह साइक्लिक पे कर प्रॉब्लम्स क्रिएट सैनिस समाजस मज वच वनु तुम दिल फुटरावन वोल जहन खराब कर वल इंसिडेंट वो गो बडगमिस मज बटमालनस मज गई बर्गलरी या अम वगैर तक वीडियो आमुत कि ये लड़क अकिस कोर दिवान धमकी वायरल गो पतमिस हफ्तस मज सह कुन नत कुन यूता परेशान करान कि वनकस हालात तीत रूदमित कि खौफी रूदमुत सोशल सैंक्शन समाज या कम चीज एहतराम बड़न हुंद क्या नबर कित बिहेव कर यूता वोतमुत कह तह कुन सात कह तुंद गर अचित तिमन तम चीज़ खौफ कहें आज करो इसी अकिस पहलुस पे कत कर कोशिश यह डोमेस्टिक वायलेंस यह जहनी अजाब जहनी इजतराब तो अम सत सान गरन अंदर वायलेंस बढ़ान तो तम सत क्या असर पेवान सह कित करो आइडेंटिफाई तम सह कित हेको टैकल कर सो दैट अगर यम मसाइल या यम असबाब बनान यह ड्रग एडिक्शन करनिक सैनिस सोसाइटी मज अगर अमिक मूल षटो ब्रोह कुन हेको मे बी ड्रग डी एडिक्शन ताम थोड़ा सा तथ ब्रेक लगवित तो आज स्पेशलिस्ट एक्सपर्ट्स जुड़ेमित नजीला गंदरोवा तो बेन कशमला कासिम जुड़ेमित नजीला यम विक्टोरिया यूनिवर्सिटी टोरंटो तथ मज असिस्टेंट प्रोफेसर तो यह स्पेशलाइजेशन इस्लामिक केयर तो यम मेंटल हेल्थ साइकोथेरेपी साइकोपैथोलॉजी ही सब्जेक्ट्स पर्नावान बेमो किताब लिखम बेसिकली यह कि डोमेस्टिक वायलेंस एस्पेशली मुसलमान जनान खिलाफ गसान तथ मज क्लिनिकली तो थियोलॉजिकली दैट मीन्स मजहबी दीनी पहलू सत क्लिनिकली या मेडिसिनल पहलू सत तथ चीज़ एंगेज कर कोशिश कर्म तो कशमला यम इस्लामी इदार कैनडास मज खलील सेंटर वन तथ सत जुड़ित यम तत ऑपरेशंस मैनेजर तो बेम यॉर्क यूनिवर्सिटी पे करान PhD जनाब युंद PhD तह इंटरेस्टिंग यम PhD करान कि मुसलमान एस्पेशली जनान मज मेंटल हेल्थ इशूज तथ मज कित हेको कुरान या दीनी पस मंजरस मज सपोर्ट ग्रुप तिमन खतर खड़ा कर तो ब्याक पहलू यह रिसर्च सह कि कुरान कित हेकान मुसलमान जनान खतर तिहज बहबूद तिहज वेल बींग तो एम्पावरमेंट सोर्स बनित यम तथ पे तहकीक कर कोशिश करान तो आज अत पे थोड़ा सा अजक सेशनस पे कत कर खतर इद्रीसा बाजी तुम करू ऐड अत पे क्या अजुक सेशन या यह कित रिलेट गसान ब्रॉडर सीरीज पकनावान
Assalamu alaikum Nazreen. Shukriya Tawsif sir. Welcome to our guests, Dr. Nazila Iskandarova and soon to be Dr. Inshallah Kashmala Qasim. Thank you for being here with us. Ith par tawanu Tawsif sir आज से वारिया खुशकिस्मती कि ऐसी चीज माहिर जुड़े में तशवे करन यमन अहम मौजून पे कत ये कि इस किस पे करो रिस्पॉन्ड जहनी बीमारन क्या कि वारियाहन यम जन كيف تشيز من اختانتهن نظرا من زيوان شي يس وشان شي اتبرتن توصيف سبنون تميوك اخ روت كوز شو آسان اخ ذهنی بیمار اخ انسان چھُ آسان مبتلا واریاہن پریشٲنین منٛز گوٚمُت یا تہٕ سٹرس وغٲرٕ وغٲرٕ باقٕے ناو تہِ چھِ وَنان تہٕ اَمہِ کہِ وجہ چھُ یہِ پَتہٕ اِنسان ژھانڈان کانٛہہ اکھ تیُتھ اکھ آوُٹ لیٹ کہِ ییٚمہِ سۭتۍ تٔمِس آرام میلہِ تَمے سۭتۍ چھِ اِمکان چھُ کُنہِ ساتہٕ چھُ یہِ تہِ مُمکِن گژھان کہِ لُکھ چھِ پَتہٕ نشَس کُن گژھان تَمہِ نشُک چھُنہٕ اَثر صرف پیٚوان تِمنٕے یوتٕے پٮ۪ٹھ اِنفرٲدی لیولہِ پٮ۪ٹھ بٔلکہِ چھُ تِہنٛدِس گرس تِہنٛدٮ۪ن ٲشناون تہٕ باقٕے سماجس پٮ۪ٹھ تہِ پیٚوان ییٚمہِ ساتہٕ کہِ تِم پَنُن نشہٕ پوٗرٕ کرنہٕ خٲطرٕ چھُ کُنہِ ساتہٕ وایلنٹ تہِ گژھان پننٮ۪ن گرِکٮ۪ن اہلو عیالس پٮ۪ٹھ یا پننٮ۪ن بچن پٮ۪ٹھ یا پننٮ۪ن زنانن پٮ۪ٹھ تہٕ یِمنٕے مسلن پٮ۪ٹھ کرو أسۍ آز کتھ تہٕ اِنشاءاللہ أسۍ کرو شروع Kashmala, thank you for being here. Nazila, thank you for being here. So what we'll do is we'll begin with Kashmala, who is today going to help us understand mental illness, how to detect it, how to respond it. And we're very, very grateful to Kashmala and to the Khalil Center for accepting our invitation and for being here and sharing your wonderful expertise in this area with people in Kashmir. So Khalil Center is going international today, Kashmala.
Thank you. Assalamu alaikum, everybody. Thank you, Idris, and thank you, Tosi, for inviting us and for the wonderful introductions as well. And I'm getting exposed to a new language, which is great to hear introductions being done in something not English. So jazakallah khair for that. Okay, so I know we're short on time today, so I'm going to try and get through most of this, and I may skip a few slides, and we can jump back later in the Q&A, and then these slides can be shared as well if that's needed, inshallah. So today the topic is around mental illness, and I'll provide just a brief introduction to mental illness, both from an Islamic perspective as well as sort of the secular mainstream psychology perspective. And I'll try and link all of this within sort of the challenges that the Kashmiri community is facing with regards to drug addictions. And then Dr. Nazila will be talking more on domestic violence. So we see that one of our earlier scholars has identified one form of psychopathology, both looking at endogenous and exogenous forms of psychopathology. So Abu Zayd al-Balkhi is a classical scholar who's done some of this work looking at the soul and looking at sort of the mind and sort of the philosophical roots of these entities. So just a very brief sort of overview. This is, he has like a lot of works on this, a lot of literature has been published on this, but to describe it briefly here, we have exogenous sources, which are more diseases or symptoms that are caused by something external. And then we have endogenous, which is something a little bit more inheritable, something that's more within. You can think about this in the modern terms, a neurotransmitters or a chemical imbalance or a hormonal imbalance, something that's more biologically related. Something like drug addictions, for example, just to put it very broadly, might be more of an external or exogenous source coming into the body and then causing certain symptoms and then leading to more pervasive illnesses as well. This quadrant I really like. It's a little bit, it gets a little challenging to explain the difference between mental health and mental illness. I think we talk about mental health a lot and we kind of lump everything together in mental health. So just want to differentiate, because as we are responding to people in our local communities, we are sort of the first responders. It's good to differentiate between the two. So number one, which I've circled in red there, that is where we ideally want our communities, our families, ourselves to be. So that is optimal mental health and no symptoms of mental illness. So optimal mental health as a broad term is looking at your coping skills, looking at your overall outlook to life. Do you have a good family support system, a peer support system? And then mental illness is more the diagnosed category of whatever illness that you might be suffering from. If you check off a certain amount of symptoms, you may be diagnosed with a specific mental illness according to the DSM, the Diagnostic Statistical Manual, which is in its 5th edition. I believe, Dr. Nazila, you can correct me on that. So this is where we ideally want to be. Number two is you may have great mental health, you might have a great support system, great coping strategies, you're eating well, you're exercising, but you are still living with a clinically diagnosed mental illness. And individuals like these do exist. When I was training to become a psychotherapist, I would see many individuals with this situation. So, alhamdulillah, their life situation was good, but they still were suffering from a serious mental illness, but they were able to overcome a lot of the challenges because their mental health was good. So, I hope that distinction makes sense. Number three is where we don't want to be. This is the most challenging situation. And this is, I think, where drug addiction, domestic violence, homelessness, these things can perpetuate this, in which you have poor mental health. Then, on top of that, you have a serious mental illness. So, for example, clinical depression, clinical anxiety, bipolar disorder, a personality disorder, schizophrenia. So, any of these categories of disorders, perhaps you're diagnosed with it. On top of that, you don't have much support systems. You don't have good coping strategies. Perhaps spirituality is important to you, and you are feeling that you are getting further and further away from your faith. Then the last category, the fourth one, is a little bit interesting, in which you have poor mental health. So, not many support systems, not good coping strategies, but thankfully, you don't have a serious diagnosed condition. So, you are not diagnosed with anything, you don't have the symptoms to check you off on that. But your mental health, just generally, you feel anxious, you feel sad, but it's not enough to be a clinical diagnosis. And I think a lot of, at least in Canada, a lot of Muslims and the people that talk to me at Khalil Center, within research as well, they're kind of in this like level 4 box. Just not very happy, not doing super well, but thankfully they don't have a serious mental illness. But their coping strategies and skills and mental health overall could be better. So there could be many situations and triggers of mental illness. Within this particular context, I have listed here as well substance abuse. So drug addictions could be one trigger. Of course, leading up to the drug addiction are several other triggers that could have led up to it. Anything that's life related, so more exogenous types of things, just stress, everyday stressors of life. Unrealistic expectations. This is a big one from a research standpoint. A lot of my participants would mention that they were expecting something to happen and something else happened. So a lot of unmet expectations. Relationships, right? We are from a collectivistic culture. We tend to live with joint families, and we meet up with family and friends. So there can be some drama, family drama, relationship conflict. These can also be triggers for leading up to a mental illness. In terms of stigma, especially within Muslim communities, this is not just in Canada, all across the world. As Muslims, we tend to experience higher public health gaps, especially for mental health. And the research shows that Muslims tend to generally have a distrust of service providers, especially because within psychiatry and psychology, just within the last decade or two, that spirituality has reemerged, and mental health practitioners are sort of allowing religion to be talked about again. But prior to that, it was quite secular. You couldn't really talk about God or prayer or reading the Quran as a form of treatment within the therapy setting. So a lot of Muslims sort of stayed away from therapy. So therefore, there was this fear of mistreatment, fear of even discrimination, Islamophobia. Language barriers seems to be a big issue as well, especially for immigrants and refugees arriving within new countries. And then just an issue of just a different understanding in terms of culture and religion. So for example, a Muslim client might be having family-related issues. They might be seeing somebody from a different culture who understands family systems differently, and then there will be a disconnect within that therapeutic setting. So that's where I think our role comes in. Even if we are not trained psychotherapists, I'm not a psychotherapist myself, I'm in research, but we all can still play a part in our communities as first responders. So think of first responders as like your paramedics, but more for the mental health side of things. And first responders, Khalil Center has sort of taken this term and defined it as individuals who are maybe community leaders, or you're very like active in the community. You could be a teacher, you could be an imam, a scholar, just someone who is within the community, who is able to respond in a crisis situation with regards to psychosocial issues. And again, your role is not to provide therapy or try like CBT or different treatment techniques here. Our role essentially within our local communities is to have empathetic listening, having a framework to intervene within the crisis situation. And again, as you are aware what is happening in Kashmir, you are well aware of just how to respond and what types of situations are happening there. And understanding your limitations and your boundaries with the people that you are serving. Many times, first responders will suffer from compassion fatigue and lots of burnout because everyone is coming to you for resources. And then finally, learning how to screen for mental illness, but not providing treatment or therapy for it. And then learning how to refer to the appropriate doctor or mental health practitioner. And this chart sort of shows us the importance and the burden that first responders carry. So I've circled in that lime green color that first responders are kind of like the informal community care setting. So it's not doctors, it's not psychiatrists. That's like way up there in the red triangle up there. But the level of care, as you can see in the diagram, that the frequency of need is quite high at this bottom level, and the cost of services are low. So many times as first responders, you're just providing just free resources, just an empathetic ear. You're just listening to people, visiting people in their homes if they're not feeling well, and then you can refer to more formalized care. But again, the frequency of need is not as high in that setting, and just the importance I just want to identify. This is what's this diagram is saying, that just the importance and the frequency needed for first responders to be on the ground with the community and really understanding the community challenges. Within the Kashmiri context, we know from the research that drug addiction recovery, a lot of it, sort of the outcomes of a lot of it tends to be hopelessness and helplessness. So when you're not getting that particular dose of a drug, you're increasing that drug, there's withdrawal symptoms. And the two main psychological symptoms, I'm not going to go into psychopharmacology, but the psychological symptoms are hopelessness and helplessness. So not knowing where to go for help, how to get help. So you end up just turning back to that specific substance for help. And then when you're not able to get that substance, then losing hope in life, in your family, in your relationships. So as first responders, especially within the drug addictions context, I think our two main objectives are providing hope for individuals and providing referrals. So the hope part is for hopelessness. The referral part is for helplessness, to help them overcome their helplessness on where to turn to, where to get that first sort of crisis intervention. So using different techniques that I will share in just a few minutes, we're providing hope and then providing the right resources or right guidance to refer them to the specialists who are able to assist them. Okay, is that making sense so far, Dr. Lisa? I want you to, if you want to jump in, or Tosif.
No, everything makes perfect sense. So please keep going.
Okay.
Yeah, we are taking notes. Don't worry.
Okay, great. Okay, so sometimes this is a funny criteria. I hope it's not offensive to anyone, but just to get a point across that many times as Muslims, we are guilty of this. I am guilty of this myself. I'm sure I've told many people many times to do this, even my own family. Someone says, like, I'm just I'm feeling sad, I'm feeling hopeless, I feel depressed. And somebody else, maybe a community leader, an imam, or just a friend might say, oh, just pray 2 rakas or make dua or read Quran and then just call me in the morning and you'll feel better. Not to say that spirituality doesn't have a role in treatment. It absolutely does. Research shows that incorporating religiosity, spirituality is effective in therapy, but we can add other things that are also shown to be effective. I'm going to skip this just for a second. I just going to come back to the research side here in terms of the positive and sort of maybe the sometimes challenging role of incorporating Deen and Islam within our treatment approaches. So when we are working with the community, just knowing that if someone would like spirituality, or they have a strong connection with Allah subhanahu wa ta'ala, they are perhaps students of the Quran, for example, that's some of my research participants, then Islam can promote patience, resiliency. It can give a different frame of reference, a different cognitive reframing. It can provide positive coping skills and just provide a stronger social network as well. But sort of the flip side of that is for someone who perhaps is not super religious, or they don't really want you to discuss religion with them, sometimes bringing in the deen can sort of backfire as community leaders, and you may sound a little bit judgmental or a little bit critical. And then, of course, being really careful not to jump to conclusions. So I've heard people say things like this to people who are in crisis situations, that Allah or God is punishing you, like Allah is angry with you. So just being really careful not to essentially weaponize Islam and taking these ayahs and the hadith out of context. And finally, as first responders, again, if we are not trained in psychotherapy, this goes for myself as well. I just have 1 year of training, but you need many more years of training and many hours of direct facing client hours. Just to remember that no therapy is better than bad therapy. So if you're unsure what to say to someone who might be in a crisis situation, they're experiencing withdrawal symptoms, perhaps they're experiencing domestic violence, something at home, saying the wrong thing can actually re-traumatize the person. So it's better just to stay silent and refer them to the appropriate person. And if you yourself, as a community leader, as a first responder, feel like you are going through some issues, definitely being introspective and reflecting on that first, and learning about yourself first. I would highly recommend even going for therapy yourself. There's so many online options available now as well, if there's not many resources available locally, and just learning about yourself before putting yourself out there to help others. Very quickly here, just want to touch upon, from a psychological point of view, just some risk factors and protective factors against mental illness. Some people ask that why is it that certain individuals can go through a very traumatic situation and they come out on the other side resilient and positive, and they're going and helping other people now, whereas other individuals might go through half of that situation and they end up developing symptoms of mental illness. So there are certain risk factors from an Islamic point of view. For someone who was always praying or attending the mosque, for example, if they experience a spiritual disconnect, that could be a risk factor. Disconnecting from family and community events, going through a recent trauma, and not having much external support, and just a lack of routine, lack of community engagement. So these are just some risk factors. Protective factors, on the other hand, is essentially the opposite. So having that family and community support. So this is where I think peer support really comes into play. Now, you can't always access a doctor. You can't always go to a therapist or even your local imam or a community leader. But if you just have even a few close, good friends, they can serve as your protective factors. They can check up on you if you've missed a few things recently, you're not picking up your phone, you're not texting them back. They can sort of be checking up on you. And the research on peer support is really strong as well on protecting against mental illness. Individuals like these can also have a lot of emotional support. They can help you with your self-awareness, active lifestyle, of course, eating well, nutrition. All of these can protect against mental illness. They won't prevent mental illness, but they can at least have some protective elements to them. Okay, so the last few things I want to talk about here, more for, I guess, the first responders, for your own reflection, and then also when we are assisting others. Just two things here very quickly, looking at personality, and then also a few tips from the psychotherapy and counseling modalities. So from a research perspective, we have this model called OCEAN, and it stands for, I think the slides are cutting off a little bit here, but the O is openness to experience. C is conscientiousness. A is agreeableness. E is extroversion / introversion. And N is negative emotionality, and sometimes I think in previous literature is referred to as neuroticism as well. So I can't go into the full scale of this personality model, but this is, I think, a great starting point just to assess yourself. And when we are speaking with others, to have a sense of what personality they're coming with as well. So openness to experience, I think, pretty self-explanatory. It's how imaginative, how creative, how outgoing even somebody might be. And this is from 0 to 100. So nobody's like 100% on each of these. Nobody's 0%. Everyone has different levels. And these are value free. So it's not like if you are extroverted, you are better than an introvert. These are completely judgment free. Conscientiousness, if you're high on that, you are quite organized, structured, orderly. People who are low on conscientiousness, they don't mind a little bit of clutter and some mess, and that's okay with them. Agreeableness is how much you value social harmony. People who are high on this are sort of like your yes men. They don't say no to anything. People who are low on agreeableness, they tend to get more into conflicts, and they don't mind being more assertive with their opinions. Extroversion is individuals who gain energy from being with other people. Introverts lose energy from being with other people. And again, this is it's a range, it's a percentage. And then the negative emotionality is how emotionally stable a person is. Individuals might be really high in emotional stability, that they're sort of about the same mood throughout the day. Individuals who are low on this trait, they may experience lots of fluctuations throughout the day. Just really happy in the morning, something happens maybe throughout the day, and they become quite low in their mood, and then they get their energy back up at night. So that's like a lower level of negative emotionality. And finally, over here, just some last tips as first responder relationships. As we assess our personalities, we can do a quick, like an assessment of others before we just jump in to help within a crisis situation. Just remember that as first responders, this is a relationship. You are not providing formal therapy. Essentially, you are trying to be as empathetic as possible, and empathy is not just like a passive thing. It's a very active process, takes a lot of work and training to stay where the client is. So whatever the client or whatever the person is coming to you with, you are staying with them in their journey and staying within their reference. Many times what we see as first responders, if they're older and they're talking to a teenager, for example, and the teenager is going through some substance abuse issues or some parental related issues, we all of a sudden become like the parent or the big aunt or the big uncle. And instead, we should be just staying within the reference. So thinking, how would I be thinking if I was 13 or 14 years old? So being really empathetic and getting to their frame of reference. And just some strategies when we are speaking with individuals, whether they're in crisis situation or not. You can follow this, another acronym, SOLAR. So facing the person squarely, so you're looking at them directly, having an open posture, so you're not going to talk like this and with like your face down and your arms across like you're mad at them, for example. Leaning toward the person, really showing that active listening. Having frequent eye contact, if that is, of course, culturally appropriate. And then the R is for relax, because sometimes you get so stressed out within our roles and we really want to try and help everybody, but we need to also have that posture and that element of being at peace with ourselves, relaxing, so we can take on some of the emotions of the other individuals. And finally, just some tips on active listening. So when we are assisting others, make sure you clarify the situation. You might think that you know the challenges that the community is facing, but really clarify what the person is saying. Best way to do that is paraphrase. So if someone says, I went on a trip with my friends, they offered me a dose of heroin or just any other drug, for example, you're just going to paraphrase that. So you're just going to repeat that back to them in your own words and say, did I understand that correctly? Am I understanding you correctly? So just always clarify instead of jumping to conclusions. And then, of course, reflecting and summarizing what the person has told you back to them and out loud as well. And then just being mindful of some pitfalls of these counseling techniques. These are, again, very basic counseling techniques. This is not necessarily therapy. So not rehearsing what you're going to say to individuals who might be in crisis situations, not placating and just saying, oh, it's okay, it's not a big deal. Other people have gone through worse situations and this is like nothing at all. So being really careful not to minimize people's situations. Being mindful of identifying, so just saying, oh yeah, I also went through the same thing. Do you want to hear my story? So don't bring yourself into it, but listen to the other person. And then finally, of course, within the Islamic framework as Muslims, and of course, I think we all know sort of the legal ramifications of religious injunctions around substance abuse, around domestic violence, but this is not the time and place to put out a fatwa or a religious injunction or talk about heaven and hell. And this is not the right place for that. So being really mindful of not being judgmental. Okay, so I'm just going to end here as a quick reflection, just for all of us to think about. How do you feel after learning about some of these things as a community leader, a trainer, or a first responder within your local community? And what types of strategies do you use, or what things do you think you might be using from this talk? Thank you so much.
Thank you very much, Kashmala. I know, Tawseef, so we have a massive task of, we can do this together. So let me get started. So I'm just going to do a very brief thing, but Tawseef was taking extensive notes. The azkis shumarus mans kor es Kashmalan varya madat ye samajhnas khadre ki yem satan ti es wuchon kah insan es أكيس مشكلات ستسامنا كران يا آسبارة مشكل وقت اسمز تم ساتن كيف شو سون رول نا كي إيش دكتور يا إيش ثيرابي دينويل سبيشالست بلكي يمنزنس first responders يعني كي first responder كوشو سو هيك أك إمام تي أسد سو هيك أك زوج تي أسد سو هيك أك بيكا تي أسد يمس مزدوي تُہۍ ہیٚکِو ییٚمِس سۭتۍ تُہۍ ہیٚکِو شِیر کٔرِتھ ییٚمِس سۭتۍ تُہۍ ہیٚکِو کَتھ باتھ کٔرِتھ یِتھ پٲٹھۍ اَسہِ پٔتمہِ لَٹہِ تہِ ووٚن کہِ سُہ اِنسان گژھِ سُہ آسُن ییٚمِس منٛز تۄہہِ کانفِڈَنس آسہِ یُس نہٕ تُہٕنٛز کَتھ پَتہٕ بیٚیِس کٲنٛسہِ وَنہِ کشملن کیٛاہ ووٚن اَسہِ آز چھُ کہِ یہِ چھُ گۄڈٕ ساروی کھۄتہٕ بوٚڑ چیٖز چھُ گۄڈٕ اَسہِ وٕچھُن أسۍ چھا تہٕ اَسہِ چھا سۄ کیپیسٹی کہ أسۍ ہٮ۪کوا بیٚیِس اِنسانَس مدد کٔرِتھ اَسہِ چھا پانہٕ سُہ ذہنی صلٲحیت ییٚمہِ سۭتۍ أسۍ چھا پانہٕ تَتھ بیلَنسڈ توازُنَس منٛز چھا أسۍ کہِ أسۍ ہٮ۪کو بیٚیِس کٲنٛسہِ مدد کٔرِتھ اَسہِ ما چھُ پانَس کینٛہہ مُشکِلات یا پانَس کینٛہہ مُصیٖبت کہِ ییٚمہِ ساتہٕ أسۍ وٕچھون دوٚیِم اِنسان چھُ اَسہِ نِش یِوان مدد ہٮ۪نہٕ خٲطرٕ تَمہِ ساتہٕ چھِ أسۍ وَنان تٔمِس ہے اَدٕ کیٛاہ مےٚ تہِ اوسُے یہِ گوٚمُت پَتہٕ وَنہٕ بہٕ ژےٚ پَنٕنۍ کہانی تہٕ سُہ وَن کشملن دیُت اَسہِ ریٖسٲرٕچ بیسڈ ساینس کہِ مُطابِق کیٛاہ چھِ ضروٗری چیٖز یِم نفسِیٲتی حِسابہٕ اَسہِ پنٛنِس پَسہِ منظرَس منٛز تھاوٕنۍ پَزَن تہٕ پَتہٕ گژھِ سُہ اکھ قٕسمُک سُہ سپوٹ ییٚلہِ أسۍ تٔمِس اِنسانَس دِمو سُہ چھُنہٕ اَسہِ پانہٕ دیُن کینٛہہ بٔلکہِ چھُ سُہ اَسہِ تَمہِ ساتہٕ سُہ ایز اَ پیشَنٹ ایز اَ کلاینٹ کَرُن رِفر یا أکِس تھیرَپِسٹَس یا أکِس ڈاکٹرَس تَمہِ خٲطرٕ دِژ اَسہِ یِمو واریاہ ڈِٹیلڈ آوُٹ لاین مگر میٛانہِ اندازٕ توصیٖف صٲب کَرِ اَتھ باقٕے ایڈ میٛانہِ اندازٕ چھُ ساروی کھۄتہٕ نِچوڑ یُس زَن مےٚ آو سَمجھَس منٛز سُہ چھُ یہِ کہِ سون اَکھ رول چھُ ایز فٔسٹ رِسپانڈٲرٕز یُس زَن کہِ گۄڈٕنٮ۪تھ وٕچھان چھُ کانٛہہ اِنسان مُبتلا گوٚمُت تَمہِ ساتہٕ چھُنہٕ اَسہِ تٔمِس پَنُن پان تِتھ پٲٹھۍ ہاوُن کہِ بہٕ کَرے ژےٚ روب بہٕ کَرے ژےٚ بیم بہٕ وَنَے ژےٚ ژٕ چھُکھ غلط یا ژےٚ چھُے اِسلامَس خلاف یِتھ پٲٹھۍ کوٚرمُت یا خۄدا صٲبَس نِش یہِ چھُنہٕ تَمہِ ساتہٕ سون رول تَمہِ ساتہٕ چھُ سون رول أمِس اِنسان سُنٛد بوزُن تہٕ کھُلہٕ دِلہٕ سان بوزُن تہٕ پَتہٕ تٔمِس اِنسانَس وَنُن کہِ ہے ژےٚ چھے ضروٗرت ژےٚ چھے مدتٕچ ضروٗرت اگر سُہ نَشَس منٛز چھُ مُبتلا گوٚمُت سُہ سوزُن تِتھِس أکِس جایہِ ییٚتٮ۪تھ کہِ تٔمِس مدد ہیٚکہِ میلِتھ توصیٖف صٲب مےٚ چھُنہٕ باسان أسۍ ہٮ۪کو ٹیکنِکَل چیٖزَن پٮ۪ٹھ یِم زَن یِمو ٹیکنِکَل چیٖز اَسہِ دِتۍ تَتھ پٮ۪ٹھ پوٗرٕ ڈِٹیل سان کَتھ کٔرِتھ مگر اَدَر پویِنٹٕس دیٹ آی مایٹ
Thank you so very much, Baji, and thanks a lot, Kashmala. It was a very enriching discussion, and quite a bit to take from this. And I had been taking notes, and I'll try and break them down into bite-sized chunks so that it becomes a little more comprehensible. And Baji is already, Professor Idrisa, she's already actually summed it up really well. But maybe there are certain nuanced things that I'll try and add to it rather than like giving something really different from that. So, Baji, shukriya वारिया तो ये वनु सुकरु तय सोरी असल पठन तो कड़ू निचोड़ इमेज के इमेज गूज क्या However, मैं तुल की चीज यम ब नोट्स ओसस तुलान कि एस कित कनत है को समझित ये सिचुएशन बेसिकली युस एस गॉडनिक पैटर्न पेंड ऑनलाइन किस मकसद ये ओस कि एस कित कन है को एज कोम आके किस पलजित the Kashbalun agar is discussion wusho, it was basically revolving around ki pulse kit kan hai koi sak bekis. Number one, for the heck of it, hek me kahin bekis pulse yo damna as godnet paiche कि इंसानस तमस नीड क्या तमस जरूरत क्या हेको पज पे समझित कि अमिस ये प्रॉब्लम तम पतन मून क्या तन रोल बना बस अमिस वस्ताद बनान तो बस अम सुन टीचर बस अम सुन डॉक्टर बह क्या समझन बह कत कैपेसिटी मज अमिस कत हैसियत मज अमिस एंगेज करान अंडरस्टैंडिंग द रोल एंड पोजिशन तो तथ मज कि गडनथ यमो वोन कि फर्स्ट रेस्पॉन्डर यथ वनो पन महल panun society, panun circle. For instance, me panun family, me panun neighborhood, या मेन panun समाज अस कित कन engage करान अकिस इतिस इंसान सत युस अस पतमे हफ्ते तक कत कर अस छन अमिस वुचुन यह शराब यह चरसी यह ब्याक यह कंस मोल यह कंस गोबर यह इंसान सनी पटन ड्रग्सस मज गसनस खतर यह बेमार यह अत तम हिसाब एंगेज कर कि अमिस कित कन सन जरूरत सो चीज तो तथ मज आइडेंटिफाई कर यह क्राइसिस सिचुएशन वारिया इंपॉर्टेंट चीज कर कश्मलान हाईलाइट अत मज होपलेसनेस एंड हेल्पलेसनेस सो कि यमन इंसानन हज चीज वारिया अहम यम समझ जरूरत कि लाचारी तो नाउमेदी सह अत मरहलस ताम वातनावा ये मे बी यम सुसाइडल गसान मे बी यम ड्रग्स करान मे बी यम बदल चीजन कुन गसान रोल क्या अमिस फर्स्ट रेस्पॉन्डर सुंद अतन आसान सह अमिस इंसानस सथ दिन सह अमिस इंसानस पलजुन वन पलजित कित कन हेको अगर यह रिलीजियस स्कॉलर दोप गोडनेथ यह डंड तुलन गो जहनमस सह दोज खस गोमुत यह शुमार चे हेको मुसलमान समझित कह सा अफू त गसीन से कहें सह समझन कहें यस अम ब्रोह तथ करान दयम चीज अत मज आव कि यह कि अक्सर गसान वल पीर सबस नश नमो या पर नमाज पर कुरान तो सरसी गस फर्क ठीक ईमान रूहानियत तमिक इंपॉर्टेंट तो अहम रोल सिग्निफिकेंट रोल मगर तथ सकिस इंसान क्योंकि अल्लाह ताला दुनिया बनोमुत दारुल असबाब तो अगर ये अल्लाह ताला सतन जुड़ान कह मरहल ये अल्लाह ताला किन चीज सबब कह चीज सपदनुक यह थोमुत मैकेनिज्म दैट मीन्स अस टोटल अथ ताम थवन पर कुरान पर नमाज तो गो हो सकता है 10 मज 9 लुकन खतर ग सही मगर कह इंसान यूता कि यूता पथ गोमुत कश्मलान सह क्वाड्रेंट हो कि तमिस वन एक्सटर्नल सपोर्ट जरूरत इत कन नबी पाक हंदिस वक्त मज कि जरूरत पेवान बे सहाबा तिहुंद ईमान कूता हाई तम अल्लाह ताला पे तवक्ल करान मगर तिमन जरूरत पेवान कि कह कर दुआ तिमन जरूरत पेवान कि तिम गसान हकीमस निशन सो यथे कन समझन कि यम सात यमन यह लाचारी तो नाउमीदी यम सात फिक्र तोर नंबर वन सत गंड नंबर सेकंड खोचनावन की नंबर थर्ड दग बे बढ़ावन की एंगेज तथ तरीकस मज कर कि इन राहत मिलन बे गस पाई आसन कि कतन कित कनथ करो इंटरेक्ट फर्स्ट रेस्पॉन्स मतलब यह कि अस कोत वातनावन यह डॉक्टरस नश नुन यह काउंसलरस नश नुन यह साइकाट्रिस्टस नश नुन यह गरी थावन अमिस आराम जरूरत सो एंगेजमेंट कित कनथ गस अत खतर कि आइडेंटिफाई कोर यमो कि अगर सोशल एनवायरमेंट कत करो कि माहौल अंद पक तमिक कूता रोल कि इंसानस कचा बनान कित कन बना सिचुएशन कि अक्सर यह कि यमिस इंसानस असल सोशल सपोर्ट सिस्टम दैट मीन्स घरेलू हालात ठीक माहौल अंद पक ठीक तमिस सपोर्ट यारी दोस्ती घर सोरे असल पे तम जहनी रूहानी तो जिस्मानी अफादियत सह बेहतर इन कंपेरिजन टू मैक्सिमम यथ लुक तम sort of like cut off तिमन तीजा सोशल एंगेजमेंट या इंटरेक्शन कहें तो अत मज सारे खुद बोड मे बासो सह पलजुन कित कन हेको एज कौम अकिस पलजित पाई मुश्किल हालात मज मुश्किल मरहलन मज वनकस पलजित कित कन हेको मे बसान निचोड़ द्राव तमिक सोय पलजनुक मतलब छुन युही कि सिर्फ for the heck of it कि मैं आस न पाई पान ते कुन चीज बह गस बह बेहम अमिस लेक्चर दिन बह बेहम अमिस वन तो यी कि गड छ पान तैयार गसन तम पत अत चीजस मज बेकिस सतन एंगेज करन क्योंकि यह वारिया अहम वारिया सेंसिटिव तो वारिया वल्नरेबल मरहल आसान अकिस इंसान सं जिंदगी हूं सो यह हेल्पलेस तो होपलेसनेस लाचारी नाउमीदी यमन शख्सन मजन तो यह आइडेंटिफाई गो ततन मोहतात रोजन कि मे सह कैपेसिटी कि बह हेक अमिस सत कर दयम चीज कि अगर बह कत कर मे कत लेवल पे अमिस कत कर मे यह खोचन मे अम दग बढ़ान मे यह खुश कर मे यह रिजेक्ट कर कि ऐ प्रॉब्लम यह बल सोचान अत चीजस मज तिमन चीजन मज मे बासान यह सिर्फ लाइक बैलेंस्ड अप्रोच यथ मज मे पान तैयार गन आई नीड टू प्रिपेयर माई सेल्फ एज वेल तो बेकिस खतर कित कन मे एंगेज गन तमिच तैयारी कर सो तुम मा यू ऐड कर बाजी
Shukriya Tawseef sir, excellent job as
Thank
usual.
you. Thank you.
MashaAllah.
I
Dr.
don't know. I'm sorry to cut you, Kashmila. I don't know how it hit your ears. Probably it was gibberish,
Yeah,
but
no, it was
I
fine.
guess
I
I.
can pick up some of it.
All right. Okay.
I wasn't gibberish, I can assure you, Kashmir. Thank you, Dr. Nazila. We'll turn to you. So we'll now go into understanding domestic violence from an Islamic perspective. Thank you.
Thank you so much. I really appreciate you invited me as well. We could go on and continue discussing what Kashmala presented to us in terms of domestic mental health, and also highlighting the role of societal factors, environmental factors that trigger mental health problems. So today I would like to present a very painful thing, and we see that domestic violence against women is not only the problem of women, it's not a problem of families only, it is a problem of society, and I would say that it's a global problem. The reason why I say is that domestic violence affects taxpayers. We know that globally consequences of domestic violence causes lots of money to governments and societies and families. Police gets involved, social services get involved, so many things get involved. In that respect, domestic violence is not only a woman's problem. That is why everyone has the obligation and responsibility to address domestic violence effectively, and I would say that ethically and morally. I would like to highlight the story and why I still keep telling about this woman, because there was an attempt to use Islam to justify violence against this woman. And then we had a discussion with a lawyer who wasn't Muslim, to understand that the husband who violated the rights of the woman actually also violated Islam's legal and ethical system as well. Women who often go through the experience, very painful experience, they face problems related to child custody, spousal support, the right to property. They go through the mental health, physical health problems. There's also stigma against women because the status of the woman gets degraded. So that is why that keeps many women to keep domestic violence secret and kind of a family matter, and that really makes the experience really very painful, and it takes years for this woman to stand up for themselves. Sometimes women get stuck because they don't have enough financial resources to support themselves, and also they don't have financial resources to afford the psychotherapy, medication, or right treatment. They don't have access to medical care, legal care. Police sometimes they ignore the complaints by the woman. So we see that women who face these problems, they go through many levels of problems. So in that respect, I encourage myself and also psychotherapists, psychologists, psychiatrists, social workers, police, and whoever are involved in terms of helping women who go through domestic violence, not to limit themselves to the dictionary definitions of domestic violence, because we know that there is a definition by United Nations, and every country, every government, they have their own definitions of domestic violence that highlights different aspects of domestic violence, including financial, economical, mental, emotional, physical, spiritual, religious dimensions. So every levels of domestic violence get covered in this definition. However, there is one Canadian scholar located in British Columbia. Her name is Jasmine Jivani. Jasmine Jivani wrote an excellent book in terms of discourses of denial. And in her book, she highlights that how dictionary definitions of domestic violence often neglect, or kind of they don't see violence at different levels. These definitions kind of fail to capture the levels at which violence occurs. And why this is important, because it is important if we fail to capture different levels that violence occurs, then we will have differential treatment at each level. So what are these levels? And he encourages us to look at these. For example, women go through at the first level of violence is definitely between the individuals, right? So husband and their wife, they are in this situation, and usually this kind of violence occurs within the private sphere. And again, between the individual who are related through intimacy, they are related through blood, they are related through law. And it is kind of usually gender-specific crime, and usually perpetuated by men against women. And there is another level that often we don't see this, and this is kind of within the family. Because when domestic violence happens against women, other members, unfortunately, often get involved in this kind of violence against women too. For example, mother-in-law might be involved, father-in-law, son-in-law, so sister-in-law. So everyone has a share in this kind of violence that happens against women. So dowry, we see that in some countries there is kind of concern in terms of dowry-related violence against women. There is female genital mutilation against women. So also kind of some traditional practices, I would say, that are really very harmful to women and the children. And this kind of violence usually is spousal violence. Okay, so non-spousal violence, and violence that I would say that based on exploitation of women. So we also need to pay attention to that. There is another level, and this is the violence at the community level. So that includes, for example, sexual abuse, sexual harassment, intimidation at work, intimidation in the marketplace, intimidation, sexual intimidation and harassment in the public transportation, for example, in the bus or in the school. So we also need to pay attention to violence against women at this community level. We see sometimes kind of how women get exploited through trafficking and prostitution. And when we look at the statistics, we see that most of those women did go through the domestic violence, through family, and also at the individual levels. There is also violence against women through at the state level. We also need to pay attention to that. For example, forced sterilization, forced abortion, and forced use of contraceptives. So female infanticide in many countries, this is really problematic, and also parental sex selection. So this is a violence that happens against women at the domestic, not only at the individual level, domestic level, but at the community level and also at the state level too. We also need to pay attention to global level at which violence also happens against women, because trafficking or forced prostitution is not only kind of state problem. It sometimes it can cross the boundaries of the states, and we also need to pay attention to that. We have seen in some countries where wars happen, usually women get targeted through rape, mass rape, and this is also genocide and ethnic cleansing and massacre against women at the global level and between the states. So recent example can be what happened in Ukraine. In the war in Ukraine, we have seen that how Russian soldiers use rape to violate the woman of another nation. So this is also a violence against women that we need to pay attention. Why these levels are really very important to take into consideration, because all these levels of violence not only targets the woman but also targets the nation, the whole nation. And at the end, women do suffer psychologically, mentally, physically, emotionally, financially, and economically. And the most important thing is that the human rights violated. So that is why domestic violence is a violation of human rights at the same time. And I would say that I still like what Donna Shalala from this administration of Clinton, former administration of Clinton, says that domestic violence is terror at home. So when we hear the word terror, that kind of indicates horror, the kind of horrible consequences of domestic violence. So in that respect, when we look through domestic violence from this perspective, our mind will shift, and we at all these levels we will take violence against women seriously. Consequences, of course, when someone goes through the violence, including domestic violence, they will have different kinds of feelings, where they will be scared, they feel intimidated, they feel humiliated, especially like in my psychotherapy practice. I have seen many women, they don't want to talk about the violence because they feel that their self-worth has been violated, their kind of name has been violated, they feel humiliated at different levels, so they feel powerless at the same time. And what Kashmala talked about, being helpless and hopeless, this is also relevant when women goes through domestic violence. In most often cases, in our communities, I have also seen that when we think domestic violence, many people think physical violence against women, but we know that domestic violence is not only about the physical violence. It also includes economic exploitation, financial abuse. It involves societal pressure on women. It is psychological, verbal, and we can add cyber bullying, cyber violence against women. So we also need to, in our internet age, we also need to add to these consequences the cyber violence against women, and also intimidation is a big factor as well. Unfortunately, during COVID-19, we have seen increase of domestic violence experiences, and not only third world countries, even developed countries reported that violence against women during COVID-19 increased. However, when we look at the differential treatment of domestic violence in different countries, we see that some of the countries, they are really equipped well in terms of to deal consequences of domestic violence against women. But countries where they don't have democracy, there is exploitation of people, abuse of rights in this kind of countries, they are not equipped well to deal with consequences of domestic violence. So in that respect, Muslim scholars, they pay attention to cultures and histories of oppression. So I'll give you an example from one Somali woman in Canada, in Ottawa. For example, when she faced domestic violence, she says that what I did go through in the refugee camp in Africa was more than this abuse that I see in my family. So that's why I kept her silent. And also she says that I justify my husband because of the war and trauma back home. He didn't have didn't enjoy psychological health, emotional health. That is why he was violent. Many women who come to psychotherapy, they ask this question, and rightfully they ask this question, because all these women look for the meaning in their experience. They ask, why did God put me in this situation? Why I have to go through this? And when you ask that, how do you explain this? How do you see your experience from divine perspective? And they say that probably God wants me to be patient in my situation to reward me, or it is my test. I have to go through this. Probably I did sin in the past. That is why I go through this. However, when we look at the Quran, we see that Allah is compassionate. Allah is merciful. How come merciful and compassionate God would put someone in this trial? And when we see God as merciful, definitely we say that no, this is not God's error. This is human error. But humans use the Holy Scripture to justify the behavior of abuse against another person. Quran all the time talks about mawadda, love and respect between husband and woman, and both of them have the right, but because of the system, that this system gives more power and chances to men, then man has more kind of obligation and responsibility to create peace in their family, but by not force, by respecting their wives. So that is why in the United States, they have a very wonderful project. The project's name is Peaceful Families. So how we can work on a project that creates peace in the families. Again, this is not the individual responsibility, because when we look at the violence that happens at different levels, then every structure in the society have the responsibility to contribute to peaceful families. When peaceful families are strong, then the government is also strong, and society and the nation is also strong. And when women are strong, then the nation is also strong. So we need to look at this, and I don't want to take more time because I'm very mindful, but thank you for this. And I see how much you love your nation, your community, Dr. Tosef and Idrissa. Thank you.
Thank you very much, Dr. Nazila. It was wonderful. A very quick overview with multiple aspects to it. Nazreen, yours nichod yende lecture was ye ki zan garan mans ya zanan situs shiddat yawan pesh such a kismuk المش بور إجس المس هات هسبتن جسان إيشون صرف كشير من زيودي جسان بلكي شيء أك universal phenomenon إيش بورو الدنيا هسمز جسان. I suppose you violation يا زنان خلاف يزني من ستن يسوي جبر يا تشدد شو جسان. by this consider كارون universal human rights के perspective ستن. أحكي واریاہ پہلو مش پتہ توصیف صاحب کر اتھ پٹ زیادہ وضاحت. Nazila, I just wanted to say that we have adopted Peaceful Families project here at least in Kitchener-Waterloo, and I developed a program called Safer Families, which has worked really wonderfully, and we've done a few trainings in Kashmir, and I think after listening to you we need to do a lot more within the Kashmiri context, of course. So I think using Baki Mazani Chodi Drag as सोचूं कि ये मसलो छु इशुन सिर्फ एक जनान ते तंसिस खानदार सी मंज योती के बल्कि छु अख माशरती मसला बल्कि छु अख पूरा माशरस छु अथ खतर रिस्पोंड करुन ते बे कोरिमो अख चीज वारिया वाजे सु छु ये कि इशुन सिर्फ बंद दरवाजा कमरस मज योती सपदान के बल्कि नैनवान गसान क्या वन अकिस टेक्नोलॉजी हिंदिस एजस मज रोजान तो यह दौरस मज सारी खुद बड़ चीज युस जन कि मज particularly as वुचमुत छु वारिया अहम छु सु साइबर बुलिंग यथ वनान छु یٖتِس کالَس نہٕ یِمن چیٖزن ہُنٛد تدورُک گژھِ تہٕ بیٚیہِ اَسہِ پانہٕ خیال پیٚیہِ تھاوُن کہِ یِمن فونن پٮ۪ٹھ گژھان کیاہ چھُ کورٮ۪ن سۭتۍ سپدان کیاہ چھُ چاہے تِم وَتن پٮ۪ٹھ چھِ پَکان یا چاہے تِم بَسن منٛز چھِ گژھان یا تِمن چھِ عام طور پر یِم تھریٹٕس میلان کانٛہہ چھُ تِمن سۭتۍ کانٛہہ خراب قدم تُلان تہٕ أسۍ کیاہ چھِ سانہِ سوسایٹی منٛز کیاہ سٹرکچٲرٕس چھِ اَسہِ تھٲیمٕتۍ کہِ یوٚت تِم کورِ ہٮ۪کن سیفلی گٔژھِتھ تہٕ پَنٕنۍ یِم مُشکِلات شِیر کٔرِتھ I think Tausif sir, I'll let you do the detailed bits of it, but I'm here to help.
Thank you very much, Baji, and thanks a lot, Nazila. I mean, this aspect is actually very close to me because I work on this, actually, the ideas of violence. And a couple of weeks back, I was actually teaching gender and violence to my MSc students, actually. So there's quite a bit of debate and the idea of how we associate gender and then talk about violence, especially from this Western perspective, because there are quite some points. And thank you so very much. You absolutely, I mean, nailed it. You summarized it so well, so succinctly in such little time. So quite some points for me to highlight in there. The Baji itkin tu farmawan ٲسِو نزیٖلان کوٚر یہِ واریاہ اصل پٲٹھۍ ییٖتیٛاہ کم ٹایمس منٛز ہائی کہِ زٕ چیٖز اتھ منٛز کہِ نمبر ون یُس أسۍ وٕچھان چھِ پننٮ۪ن ماجن بیٚنٮ۪ن تِمن خلاف یُس تہِ تشدُد گژھان چھِ سُہ کِتھ کٔنٮ۪تھ چھُ اَسہِ سمجھنٕچ ضروٗرت کہِ یہِ چھا ٹوٹل مےٚ کوٚر کٲنٛسہِ تھایپیر یا مےٚ کوٚر کانٛہہ فِزِکلی اٹیک بہٕ سمجھِ تٔتھۍ یوتن تشدُد کِنہٕ اَسہِ چھُ وٕچھُن سانہِ بیٚنہِ خلاف سانٮ۪ن ماجن خلاف کوٗتاہ زیادٕ چھُ یہِ تشدُد گژھان کتھ لیولہِ پٮ۪ٹھ چھُ گژھان سُہ چھُ اکھ چیٖز کہِ ملٹی ڈِمینشنیلٹی آف دِس violence against women. Number one, multiple levels at which this happens. Ki number one, اتھ چھِ واریاہ مختلف پہلو. نمبر سیکنڈ یہِ چھُ مختلف لیولن پٮ۪ٹھ گژھان. نمبر تھٲڈ یُس اتھ منٛز ساروی کھۄتہٕ زیادٕ اہم چیٖز یِمو ہائی کوٚر کہِ أسۍ کِتھ کٔنۍ چھِ مذہب مِس یوٗز کران یہِ وننہٕ خٲطرٕ کہِ نزیٖلان کوٚر واریاہ اِمپاٹنٹ پویِنٹ یوٗز کہِ یُس سون پروردِگار چھُ اللہ تعالیٰ سُہ چھُ رحیٖم تہٕ کریٖم خۄدا سون رحیٖم تہٕ کریٖم خۄدا ہیٚکی نہٕ یِتھ کٔنٮ۪تھ أسۍ ہٮ۪کو نہٕ یہِ چھُنہ اکہِ حِسابہٕ خۄدا رٔچھِنۍ اللہ تعالیٰ ہس پٮ۪ٹھ تہمت یا الزام لگاوٕنۍ کہِ ییٚلہِ أسۍ مذہب چھِ کران جسٹِفاے زنانہِ پٮ۪ٹھ پننہِ بیٚنہِ پٮ۪ٹھ پننہِ ماجہِ پٮ۪ٹھ یُس اَسہِ قومچہِ زنہِ چھِ تِمن پٮ۪ٹھ ظُلم کرنُک ییٚمہِ ساتہٕ أسۍ تتھ چھِ جسٹِفاے کران مذہب تھروٗ گوٚو سُہ چھُ اکہِ حِسابہٕ اللہ تعالیٰ ہس پٮ۪ٹھ تہِ أسۍ تہمت لگاوان نعوذ باللہ من غضب اللہ سو یِمو دوٚپ گۄڈٕنیُک اکھ اِمپاٹنٹ چیٖز کہِ ییٚمہِ ساتہٕ أسۍ وٕچھان چھِ یُس سانٮ۪ن ماجٮ۪ن بیٚنٮ۪ن پٮ۪ٹھ ظُلم چھِ گژھان مظٲلِم چھِ گژھان تشدُد چھِ گژھان کہِ اَسہِ چھِ اکثر اتھ منٛز کیاہ چھِ أسۍ وٕچھان کہِ یہِ چھُنہٕ 10 منٛز چھِ 8 کیس آسان یِم نہٕ نٮ۪بر نیرٲنی چھِ کیونکہِ اتھ منٛز چھِ اَسہِ سُہ آسان سوشلی بنٲومٕژ سُہ سینکشن اکھ سُہ سٹِگما اکھ کوٚرمُت اتھ منٛز کریٹ کہِ شرمہِ ہٕنٛز کتھ شرمندگی ہٕنٛز کتھ اگر بہٕ دپہٕ مےٚ کوٚرُکھ گرس منٛز ظُلم میٲنۍ خاندارن لوے مےٚ وغیرہ تہٕ اکثر چھِ یِم چیٖز روزان سیٖکرٹٕے یِتھ کٔنٮ۪تھ یِمو دوٚپ دوٚیِم چیٖز اکھ سُہ واریاہ اِمپاٹنٹ کیس سٹڈی کٔر یِمو ہائی سومالی زٔنۍ یُس ٲس یُس ریفیوجی کیمپس منٛز ٲس گۄڈٕ تہٕ تمہِ پتہٕ ٲس اوٹاوا کینیڈا آمٕژ تٔمِس اوس خاندار کران ظُلم 2 چیٖز ٲسۍ تتھ منٛز ییٚلہِ تِم یِمن نِش ٲسۍ آمٕتۍ سایکو تھراپی خٲطرٕ تٔمۍ اوس نس دوٚپمُت کہِ نمبر 1 اِن کمپیرزن کہِ ہُتھ مُقابلہٕ یُس ریفیوجی کیمپس منٛز اَسہِ پٮ۪ٹھ ظُلم اوس گژھان تشدُد اوس گژھان تمہِ کِس مُقابلس منٛز یُس مےٚ خاندار چھُ لایان یا ظُلم چھُ کران سُہ چھُنہٕ اتھ نِش کِہینۍ تہٕ بہٕ ٲسٕس یہِ برداشی کران مےٚ ووٚن نہٕ نٮ۪بر کُن کینٛہہ دوٚیِم واریاہ اہم چیٖز یُس یِمو ہائی کوٚر کہِ سۄ ٲس اکہِ حِسابہٕ صرف ٹرایِنگ ٹُو میک سینس آف دِس تھنگ کہِ سۄ ٲس سمجھنٕچ کوٗشش کران کہِ یُس مےٚ یہِ ظُلم گژھان چھُ تہٕ گژھان کیازِ سۄ ٲس کہِ یِتھ کٔنۍ میٲنۍ خاندارن یُس تٔمۍ ظُلم چھُ نٮ۪برٕ وٕچھمُت کہِ یِمن حالاتن منٛز کانفلِکٹ اوسا وغیرہ یِتھ کٔنۍ أسۍ کٔشیٖر منٛز چھِ وٕچھان تو ییٚمہِ ساتہٕ تِمن پٮ۪ٹھ ظُلم چھُ گژھان پتہٕ چھِ تِم پننہِ کھۄتہٕ مے بی کمزور پننہِ کھۄتہٕ یا یُس کم آسہِ تِمن پاورس منٛز تِہنٛزِ اتھارٹی اندر حِسابن which again is wrong پتہٕ تٔمِس پٮ۪ٹھ سُہ ظُلم یا تٔمِس پٮ۪ٹھ سُہ شرارت کڑنٕچ کوٗشش کران these were the 2 ways ییٚمہِ سۭتۍ تِم سُہ try to make sense of these things تہٕ بیٚیہِ اکثر کیاہ چھُ آسان کہِ سانٮ۪ن ماجٮ۪ن بیٚنٮ۪ن نِش چھُ یوٗجولی فاینانشل رِسورسز کم آسان فاینانشل رِسورسُک مطلب گوٚو کہِ تِمن نِش چھنہٕ اقتصٲدی انڈِپینڈنس یا تِمن نِش چھُنہٕ تیوٗتاہ پونٛسہٕ یا وغیرہ آسان کینٛہہ کہِ نمبر 1 تِم ہٮ۪کن پنُن خیال تھٲیِتھ اِن دَ سینس ڈاکٹرس گژھنا لیٖگل رِکورس رٹنا سایکو تھراپی خٲطرٕ گژھنا وغیرہ یِم چیٖز کرنا بِکاز تِمن نِش چھِ تیٖژاہ رۄپے یا تمہِ حِسابٕچ انڈِپینڈنس چھُنہٕ تِمن نِش آسان کینٛہہ پتہٕ دوٚپ یِمو کہِ یُس أسۍ پننٮ۪ن ماجٮ۪ن بیٚنٮ۪ن پٮ۪ٹھ ییٚمہِ حِساب تہِ تشدُد چھُ گژھان سُہ کِتھ کٔنۍ چھُ اَسہِ سَمجُن. نمبر 1 چھُ کہِ اِنٹرپٔرسنل لیول کہِ اکثر بوے چھُ کران بیٚنہِ پٮ۪ٹھ خاندار چھُ کران خاندارنہِ پٮ۪ٹھ مول چھُ کران ماجہِ پٮ۪ٹھ گوٚو اِنٹرپٔرسنل لیول کہِ یُس اکھ فرد بیٚکِس فردس خلاف چھُ کران سُہ گٔے اکھ. دوٚیِم لیول یتھ پٮ۪ٹھ اَسہِ یہِ سمجھنٕچ ضروٗرت بیٚیہِ چھِ اکثر ییٚلہِ أسۍ وٕچھو اَمِکۍ پہلوٗ سُہ تہِ کرٕ بہٕ اِنشاء اللہ ہاے لایٹ کرنٕچ کوٗشِش. گرس أنٛدرٕ گوٚو یہِ چھُنہٕ خاندارٕے یوتن کینٛہہ بوے یوتن کینٛہہ پتہٕ چھُ سُہ اکہِ حِساب ییٚلہِ أسۍ ونان چھِ پوٗرٕ فیملی چھِ گژھان کُنہِ ساتہٕ أمِس زنہِ خلاف یا اتھ چیٖزس پٮ۪ٹھ ژھۄپہٕ روزُن یا یہِ نارملایز کرُن یا اتھ چیٖزس ساتھ دیُن یا اتھ چیٖزس خلاف نہٕ کتھ کرٕنۍ کینٛہہ گوٚو یہِ فیملی تہِ چھِ کُنہِ نتہٕ کُنہِ حِسابہٕ اتھ منٛز شٲمِل گژھان. تمہِ پتہٕ ووٚن یِمو کوٚمنٹی یا قومی سطحس پٮ۪ٹھ تہِ کِتھ کٔنۍ چھِ گژھان سُہ چھُ اَسہِ واریاہ اَصٕل پٲٹھۍ پتہ. یُس مےٚ دوٚپ کہِ یُس یہِ ویٖڈیو اوترُک ہاے لایٹ گوٚو ییٚمہِ اکہِ حِساب سُہ چھُ روٗحٲنی اذیت أکِس انسانس دِوان کہِ وتہِ پٮ۪ٹھ چھا پکان سٲنۍ بیٚنہِ یا گاڑِ منٛز چھا سٲنۍ بیٚنہِ کمہِ حِسابٕچ کیاہ ہیراسمنٹ چھِ أمِس گژھان تِمن جاین پٮ۪ٹھ چاہے أمِس چھا کانٛہہ وِسل بچاوان کانٛہہ چھا أمِس کیٹ کالِنگ چھا کران یا کانٛہہ چھا أمِس گاڑِ منٛز چھیڑنٕچ کوٗشش کران یا ایوٕن پتہٕ ووٚن یِمو سُہ سایبر بُلینگ ہُنٛد تتھ پٮ۪ٹھ تہِ واتہٕ بہٕ. سٹیٹ لیولس پٮ۪ٹھ یُس یِمو دوٚپ سُہ چھُ اکثر آسان اگر أسۍ وٕچھو میانہِ سمجھِ حِساب کہِ ییٚمہِ حِسابٕکۍ أسۍ قانوٗن ییٚمہِ حِسابٕکۍ پالسی چھِ أسۍ وٕچھان کہِ سُہ چھُ اکثر مردو آسان بنومُت اِن جنرل تہِ اگر أسۍ لا وٕچھو کُنہِ تہِ مُلکس منٛز پتہٕ تُہۍ امریکہ ؤنِو یا بیٚیہِ کانٛہہ سُہ چھُ ہمیشہِ ٹِلٹِڈ آسان مردن خٲطرٕ کیونکہِ یوٗجؤلی قانوٗن کانسٹِٹیوٗشن اگر وٕچھو سُہ چھُ مردو آسان بنٲومٕتۍ تتھ منٛز چھِ زٔنۍ ہمیشہِ آسان ایٹ ڈِس ایڈوانٹیج. تمہِ پتہٕ ووٚنو یِمو کہِ اگر أسۍ زیادٕ وٕچھو کہِ پالسی چھِ بنان فار انسٹنس سیکس ڈِٹرمِنیشن چھِ آسان یا زنٮ۪ن خلاف کمہِ حِسابٕچ کیاہ پالسی چھِ آسان یا یُس أسۍ یہِ فیٖمیل گٔرل چایلڈ اِنفینٹِسایڈ چھِ کران تِم چیٖز گوٚو سٹیٹ یا انٹرنیشنل لیول ییٚمہِ ساتہٕ قومن منٛز جنگ چھِ گژھان یا سِول وار سچویشن ییٚمہِ ساتہٕ چھِ گژھان زٔنۍ کِتھ کٔنۍ یہِ چھِ اَسہِ واریاہ اَصٕل پٲٹھۍ پاے پتہٕ سٲنۍ موج سٲنۍ بیٚنہِ کِتھ کٔنۍ چھِ استعمال یِوان کرنہٕ چاہے سُہ ماس ریپٕس چھا یِم اَسہِ اَصٕل پٲٹھۍ پاے چھِ چاہے سُہ جینسایڈ چھا گژھان وغیرہ چھا گژھان تِمن لیولن پٮ۪ٹھ انٹرنیشنلی کانٛہہ تہِ کانفلکٹ زون اگر أسۍ تُلو یا کانٛہہ تہِ سِول وار سچویشن اگر أسۍ تُلو تتھ پٮ۪ٹھ چھِ أسۍ ہٮ۪کان یہِ وٕچھِتھ. تہٕ پتہٕ دوٚپ یِمو کہِ یہِ چھِ بیسِکلی اگر أسۍ پننٮ۪ن ماجٮ۪ن بیٚنٮ۪ن پٮ۪ٹھ تشدُد چھُ أسۍ وٕچھان یہِ چھِ اصلی اِنسٲنی حقوٗقن ہٕنٛز پامٲلی یُس أسۍ اِنسٲنی حقوٗقن ہٕنٛز کتھ چھِ کران ہیوٗمن رایٹسٕچ کتھ چھِ کران بیسِکلی یُس سانہِ ماجہِ یا سانہِ بیٚنہِ پٮ۪ٹھ چھِ گژھان تشدُد یا ظُلم چھِ گژھان یہِ چھُ پننِس پانس منٛز اکھ ہیوٗمن رایٹس وایلیشن تہٕ امیِکۍ نتیٖجہٕ کیاہ چھِ نیران امیِکۍ کانسِکوینسز کیاہ چھِ آسان کہِ یُس زٔنۍ یُس چھِ یہِ چھِ ملٹِپل لیولن پٮ۪ٹھ سفر گژھان أمۍ سٕنٛز اذیت چھِ گژھان واریاہن سطحن پٮ۪ٹھ کہِ گۄڈنِکی کتھ چھِ یہِ چھِ کھوژان أمِس چھِ بے عزتی گژھان أمِس چھِ باسان أمِس چھِ استحصال گوٚمُت أمِس چھِ پننہِ جایہِ بیٚیہِ اگین سُے لاچٲری تہٕ نا اُمیٖدی باسان تہٕ بیٚیہِ چھِ أمِس باسان مٲنِو تُہۍ یہِ چھُ پوٗرٕ مارجنلایز أمۍ سٕنٛدۍ حق چھِ بیٚکہِ سٕنٛدِس مُقابلس منٛز واریاہ واریاہ زیادٕ کم سو یہِ چھُ پوٗرٕ مارجنلایز گژھان کہِ اکہِ حِساب چھِ یہِ گژھان پننہِ یتھ منٛز تتھ ہایرارکی منٛز بوٚد تتھ سب ہیوٗمن کیٹگری منٛز چھِ یہِ گژھان کہِ ییٖتیاہ مے بی میٲنِس خاندارس میٲنِس بٲیِس میٲنِس مٲلِس حقوٗق چھِ آی ایز اے وومین مے بی مےٚ چھِنہٕ تیٖتیاہ حقوٗق کینٛہہ ماے رایٹس کمپیرٹِولی لیسر سو یِم چیٖز چھِ یہِ گژھان. بیٚیہِ دوٚپ یِمو کہِ یُس یہِ ییٚلہِ أسۍ لیولن ہٕنٛز کتھ چھِ کران یا ڈِمینشنن ہٕنٛز کتھ چھِ کران اَسہِ چھُنہٕ ٹوٹل وٕچھُن کہِ یہِ چھُ فِزِکل وایلینسی یٲژَن کہِ کٲنٛسہِ دِتُکھ مار فِزِکلی کوٚرُکھ کانٛہہ ازالٹ. دوٚیِم چیٖز چھِ یِہے اگر أسۍ وٕچھو یہِ چھُ سوشل امیُک آسپیکٹ یہِ سمٲجی لیولس پٮ۪ٹھ کوٚت چھِ یِہٕنٛز پرتیٖت یا یِہُنٛد یُس یہِ سٹینڈنگ چھِ أکِس زنہِ ہٕنٛز کلچرلی کِتھ کٔنۍ چھِ یِوان یہِ سمجھنہٕ یا فینانشلی کوٚت چھِ یہِ واتان کہِ أکِس زنہِ چھِنہٕ تیوٗتاہ اختِدارٕے روزان کہِ أمِس روزیا سُہ فینانشل انڈِپینڈنس کہِ یہِ ہیٚکہِ پنٕنۍ فٲصلہٕ پانہٕ تُلِتھ یا بیاکھ ووٚن یِمو سایبر یُس بیاکھ اکھ ایسپیکٹ چھِ سٲنۍ موج بیٚنہِ کُنہِ تہِ جایہِ پٮ۪ٹھ سوشل میٖڈیا وغیرہ چھِ تتھ پٮ۪ٹھ کۭژاہ ہیراسمنٹ چھِ یِمن گژھان یا فونن پٮ۪ٹھ کوٗتاہ چھِ یِمن ہیراسمنٹ گژھان تو انفارچُنیٹلی کہِ یہِ چھنہٕ أکسٕے سطحس پٮ۪ٹھ أکسٕے پہلوس منٛز چھِنہٕ یہِ سمجھنٕچ ضروٗرت کینٛہہ یہِ چھِ أکِس انفرٲدی فردٕ پٮ۪ٹھ پوٗرٕ سٹیٹ یا انٹرنیشنل لیولس تامتھ ہر حِساب سٲنۍ موج تہٕ بیٚنہِ گژھان استحصال بیٚیہِ چھُنہٕ یہِ ٹوٹل أمِس فِزِکل مارٕے یوتن کہِ یہِ چھِ حِساب ہر أکِس پٔرسپیکٹِوس منٛز یِوان مارجنلایز کرنہٕ. پتہٕ کٔر یِمو کووِڈ-19 تہِ کتھ کہِ کِتھ کٔنٮ۪تھ مُختٔلِف مُلکو مُختٔلِف گورمینٹو کوٚر سُہ استعمال زیادٕ ظُلم کرنہٕ خٲطرٕ یا مُختٔلِف سوسایٹین منٛز کِتھ کٔنٮ۪تھ بنیو یہِ اکھ ریٖزن कि ज़्यादा ज़ुल्म यी सानन ज़नानन पेठन करन तो एंड को यिमो अथी चीज़स पेठन कि अस पज़ यह समझुन कि युस सन मोज छ सानि बेन छ सानिस कौमस मज तिम छ सोन सरमाय तिमै छ सोन घर ते स्ट्रांग बनावा तिमै छ सोन कौम ते स्ट्रांग बनावा यीचा बेहतर यीचा असल बहबूद सानन बेनन हस आस सानन माजन हस आस सानन कौमचन ज़नन हस आस तीचा बेहतर बहबूद छ पूर सानि कौमच inshallah. So Baji, would you like to add something to this?
No, I think you did a wonderful and comprehensive job. Just mindful of time, and before we let our speakers go, Nazila and Kashmala, I would, of course, first of all, most grateful for your presentations and your thoughts and comments. I think this is more of a first responder question, both from the perspective of domestic violence and identifying or supporting those who are struggling with challenges with mental health. What would you say to our listeners, particularly those who are first responders, whether they're imams or community leaders or on the ground social workers? What are some of the things that you would say they need to do, given the context that they are operating in? Some practical tips that you could leave us with to address these issues, from generic to more particular right now. And Nazila, I have the same question for you, because I'm sure there are many imams and other community workers listening to this conversation. What would you like us to do as a community so that we are better, able to, or in a better capacity to respond to the scourge of domestic violence? Kashmala, if you want to go first, and then Nazila.
Yeah, sure. So just there's lots that can be said, but very briefly here, I'll just categorize into two things. So one is just individual things that can be done, and one is more group and collective things. And this is just from a research perspective. So just I've done a few studies talking to imams who are in this role, who see a lot of these types of challenges within the Toronto community. From an individual perspective, many first responders have said that this might seem a little bit like maybe a bit cheesy or a bit like Western and mindfulness related, but just keeping some form of like a journal, a diary. It doesn't have to be like your typical journal where you're writing down like your feelings and emotions every night, but just a log of the types of challenges that you are seeing, and then also reflecting on how you felt, what were you able to do that was correct, where did you need help. So either typing up like a log or a diary or a journal just for your own personal growth and reflection, that would be number one. And then secondly, for the group and collective sort of interventions, a lot of the first responders have said that any sort of group trainings have really helped them. So instead of just doing individual trainings, everyone's sort of scattered. Someone's listening to like a psychotherapy course here, someone's attending a workshop there. Instead, they all come together in different groups and do a group training. It could be a peer support training. It could be like your basic counseling 101 type training, basic like level 1 cognitive behavioral therapy training, trauma-informed training, just even virtually has been very effective, but at a group level. So that the group mirrors and learns from each other, shared stories, and that seems to be the most effective, at least from a research perspective, within the participants that I interviewed.
Thank you. That's very, very helpful. And I hope those experts who are listening to us in Kashmir will take some of those suggestions and implement them on the ground. Nazila, please.
Yeah, thank you, Kashmala, for your suggestions. I also emphasize what you suggested. Self-care is really very important, because dealing and helping these women who go through domestic violence takes lots of effort, and some people might feel burnout because of the level of the work. That is why self-care is very, very important, and also training. And as Kashmala suggested, when we feel that we cannot deal with the situation, it's very important to identify that this is time to make referral, and working in a group environment is really very important, because it's a team approach. Teamwork is really very important, because women who go through domestic violence, they do need different types of help.
Thank you both for those valuable suggestions. And before Tawsif summarizes those, are there any important questions that have come in, Tawsif, that we should address with our experts? You're on mute.
Not really that I can look at, but there was just one thing comment from somebody asking us to speak in Urdu. However, if I may answer to them, as these are Murphy, क्योंकि कٲشِر छ سٲنۍ زبان اَسہِ چھُنہٕ کٕہٕنۍ یُتھ پلیٹفارم یُس وٕنیُس تام ایکسکلوٗزِولی کٲشرِس پٮ۪ٹھ اوس ترجیح دِوان سو مہربٲنی کٔرِتھ اگر تُہۍ تہِ تھوڑا محنت کٔرِو کٲشُر سمجھِو نتہٕ چھِ باقی پلیٹفارم ماشاء اللہ انگریز اردو پٲٹھۍ واریاہ اصل سانہِ نِش واریاہ بہتر یِم پروگرامز چلاوان سو معٲفی دیٖزیو أسۍ ہٮ۪کو نہٕ کٲشِر ورٲے بیٚکِس زبٲنۍ پٮ۪ٹھ یوٚتام نہٕ ایبسلیوٗٹلی نیسسری آسہِ کینٛہہ سو کم سے کم اکھ پلیٹفارم گوٚژھ آسُن یتھ پٮ۪ٹھ پنٕنۍ کٲشِر زبان موج زٮ۪و تمہِ حساب روزِ ہے یُس اَسہِ ضوٚرتھ ٲس So, Baji, I didn't actually get any sort of like relevant questions either in my personal messages or
That's
on
perfectly fine.
comments.
I think
But,
you and I can have a further conversation because I'm mindful that both of them have to go. Let me
Yeah.
just give them a last minute. Are there any points, Nazila or Kashmala, that you would like to emphasize or anything that you would have liked to talk about but didn't have time to say? So looking for that. Just last comments.
Totally. And if I may add to that, one bit would be really important. That's the element of self reflection. So, going a little preemptive rather than waiting for the problem to happen and then the kind of curative measures that you take in there. What is that bit for an individual, maybe within themselves, that they should focus on in order to preemptively sort of like avoid getting into this big and massive whirlpool of mental issues or like weaknesses or that leads to these kind of issues? Is there something that individuals need to reflect or be prepared within their own selves in terms of their reflections or attitudes?
Kashmala, you want to go first?
So I asked Dr. Nazila if she wanted to go first this time. I've been taking up the first position for a few minutes now. I would say I know for just within my own just like network, my family and friends, and just my teachers as well. This I don't know if this is we can send something like this, but I always just send around. It's like a very nice self-help tool. It's a thoughts and emotions chart that was shared with us by our professors as well. So it's just like a self-help tool. All the instructions are there, and you literally just use it. You mark down your emotions, you rate your emotions, and the perspective of this chart is not to reduce any negative or get rid of any negative emotions, but simply to reduce it. So for example, you've been maybe out in the community just all day listening to people's stories and their struggles, and you're at like a 10 in terms of your own anxiety, for example, or your own struggles. You can, before going to complete burnout mode or just you developing symptoms of clinical anxiety yourself, go through this chart, and it tells you different questions that you can reflect on, different exercises that you can do you can do it in your car, you can do it at home, just to get that number down to maybe a 5 or a 6. And that it's just even that shift in emotional negativity and just your own self-regulation of emotions, that I feel has really helped. And this resource it's a free resource. I can even share it.
Yes, if you don't mind sharing that, then we can share it with everybody. Nazila, any last points?
So I would say that in Islamic tradition, we have a wonderful mindfulness techniques. This is called muraqabah. And one of the techniques in muraqabah that we use is tafakkur and tadabbur and muhasabah. So muraqabah comes from the word raqabah, that means watching and observing. In the Quran, one of the names of Allah is also Raqib, watching and taking care of his creation. So in Sufi traditions, they use muraqabah to observe and be mindful of their emotions and feelings, including unpleasant ones, and in order not to avoid them, but just observing them, how they affect the person. So in that respect, I would say that muraqabah is a wonderful tool for self-reflection and for tafakkur and tadabbur.
Thank you. Thank you so much, Dr. Nazila. And I know you're an expert in that area. And inshallah, maybe in the future, we will do a whole session that is dedicated to muraqabah and to mindfulness in general, as, mindfulness from an Islamic perspective. I can't thank you both enough for your contributions, for the richness of your discussions and your presentations. And most grateful to you, Nazila, and University of Toronto at Kashmala, you and the Khalil Center for your presence and for your thoughts and wonderful guidance and teaching. So we will bid you goodbye. I know you have other things to do, and Tasif and I will do a bit of wrap up.
Absolutely. And thank you so very much for your time. And what an absolutely wonderful point to end on. Muraqaba, maybe inshallah after you're gone, we'll talk a little bit about this. It was absolutely wonderful endpoint, like the best coda that we could have. So yeah, thank you so very much. And maybe inshallah in future we connect again, talk about some other things, maybe building on from where we leave today. So yeah, thanks a lot for your time and engaging with us.
And thank you, especially from Kashmir, to all of you.
Absolutely. Assalamu alaikum from Kashmir.
Assalamu
Though I'm
alaikum.
in England right now.
Okay, thank you so much for having us. Really
Right.
appreciate it.
Thank you.
Just thank you very much. Assalamu alaikum.
Assalamu
Wa
alaikum.
alaikum assalam wa
Sure.
rahmatullah.
توصيف سب in case مادي زرس mit summary كشير pattern كي موقع من آخر pattern
बिल्कुल absolutely बाजी एंडस पेटन युस अस कत कर सो यह कि इंसानस कूचा ज्यादा जरूरत पन्नस पानस पेटन थोड़ा सा नजर त्रावनच कि अगर बह वनान कि यह फर्स्ट लाइन ऑफ डिफेंस या फर्स्ट रिस्पॉन्डर्स तिमन कूचा ज्यादा जरूरत नंबर वन पन ख्याल थावनच पान यह समझनच कि तथ कैपेसिटी मजन हेको लुकन हज मदद कर तो पान ते रिफ्लेक्ट कर क्योंकि यम सात वनान कि बाकियन लुकन अगर एंगेज कर यमिस प्रॉब्लम गमज यह पन्नस पानस मज यूत टैक्सिंग की जॉब आसान कि सैनिस जहनस पे असर कर क्योंकि कुतः ददवन बोज अल्टीमेटली इंसान तम सत्न मुतासर सो पन ख्याल थावन अत चीज़स मज ज़्यादा ज़रूरी बे कित इंसान यह मुतयन कर कि जहनी तौर मे कुतः असर गोमुत या बह कित था पन पान ठीक तथ मज दोप यमो कि इन फ्रीली अवेलेबल चार्ट्स मे बी हेको कशमलास मंगित तम चार्ट्स हेको पन्न लुकन सतन सो चीज शेयर कर दोयम पहलू अत मज हाईलाइट कोर वॉज कि क्या हेको कर प्रीएम्प्टिवली कि प्यारोन यह मसल गस कि जहनी तौर गसो परेशान या जहनी इस्तिसालस या इजतराबस मज गसो मुलविस तमें ब्रोह क्या हेक इंसान कर कि अम नश बचे क्योंकि वुचान कमन मरहल कमो मरहलो मज नेरान कमो कम हिसाब क्यों हालातों मज वनस कमन मसलन मज दरपेश वनस कि सह जहनी तौर सैनिस गरस मज माशरस मज कौमस मज अकिस इंसानस परेशान करान तो इंसान क्या हेक कर शख्स फर्द क्या हेक कर कि जहनी इजतराब जहनी इस्तिसाल अम चीज नशन हेक यूत वो यूत पन पान बचवित कि तथ तथ मरहलस ताम वातन कि खुदा रचन यमन मसलन मज वनस गमत मुलविस तिमन मसलन मज वातन कि चाहे सह ड्रग अब्यूज चाहे सह डोमेस्टिक वायलेंस चाहे सह सुसाइडल थॉट्स सो तथ पे कर नजीलान वारिया अहम कत कि अल्हम्दुलिल्लाह मज मुसलमानी कि सारे खुद बेहतरीन अत मज दवा सह मुराकबा पन दीन हेचनावान यथ मज तदब्बुर तफखुर मुहासबा गो नंबर वन बहुत नजर त्रावान पन्नस पानस पे अगर मे दोहस कह कोर शामन बह रिफ्लेक्ट करान तथ चीज पे मे कोर क्या मे वुच क्या पानस अंद पक मेन हरकत कित तो तमिक पे मुहासब कर यह कूता सही कूता गलत चाहे खुदा सजन नजरन मज चाहे दीनी हिसाब चाहे दुनियाई हिसाब तो कतन कतन पज मे तथ चीज मज इम्प्रूव गसन बे चीज अत मज हाईलाइट गो सह यह कि अल्लाह ताला बनमति बेकिस पल्सन खतर सोशल बीइंग्स तो पन पान टित थावन कह ये पे वनान शिनिया कह सो कर बेकिस रलित मिलित रोजन तवे अम हिसाब ये वनान अल्लाह सोन दीन कुता पोज कुता सही कि कचा ज्यादा रिश्तन हज अहमियत सलाम सलाम बेकिस कर या अल्लाह ताला कुता ज्यादा मनई कर्म कि रिश्त चटुन तथ चीज़स पे तो वनकस समझान कि इंसानस या इंसानी बहबूदस खतर कचा ज्यादा जरूरी बेकिस जुड़ित रोजन समाजस मज बिल्कुल समझी तरीकस पे जिंद रोजन यस बाजी तुम करो आदत की
أنا شكرا صرف شو يوانن كي I think أگر إس إمز كي هيتشوف سوشية كي يوز زنانن ست شدت شو غسان غرن من شو غسان يا وطن پر شو غسان يا بسن من شو غسان يدي شو غسان إيشان زنانن his problem كي سوس أخ بياخ نيچوري هندي يهندي discussion أوك كي إيش إسانيس پور سماجك إيش إسان سارني his responsibility तो ये हकम ने ये बार ते हकम ने زنان पर तरह तुम شو already बार बार तुलान ये तमन पन्ने problems शासन पन्ने गरन मस problems शासन आख support system छो ऐसे ज़रूरी create करन ये ते सुजाय कि यो तसी ज़नान है कि गसित ये ते तमिस का है कि judge कर بیاکھ اکھ پہلو یُس زن اَسہِ ترجم کوٚر سُہ اوس یہِ کہِ واریاہ چھِ ایٚکسپلایٹ یا ابیوٗز کران امیُک غلط معنے کڑان کہِ یہِ چھُ مےٚ چھُ صٲبِر روزُن کہِ صبرُک مطلب چھُنہٕ یہِ کہِ اللہ تعالیٰ ہن چھُنہٕ زانٛہہ کٲنٛسہِ پٮ۪ٹھ عذاب یا شِدت کرنُک اِجازت دیُتمُت تہٕ صٲبِر روزنُک مطلب چھُنہٕ کہِ چاہے مےٚ سۭتۍ چھُ شِدت گژھان تہٕ لہٰذا کرٕ نہٕ بہٕ کتھ کِہینۍ تِکیازِ کہِ مےٚ چھُ شاید یہِ ازمٲیش یِم ٲسۍ 2 چیٖز یِم زن ڈاکٹر نزیلاہن بڑٕ ہاے لایٹ کٔرۍ کہِ یہِ چھُنہٕ وَنُن کہِ یہِ چھُ مےٚ خۄداے سٕنٛدِ طرفہٕ ازمٲیش تہٕ مےٚ چھِ یِوان شِدت تہٕ وۄنۍ چھُ مےٚ صٲبِر روزُن تہٕ بیٚیہِ چھُنہٕ یہِ ایٚکٕسکیوٗز کَرُن یہِ نہ کہِ اَتھ چھُنہٕ کانٛہہ جوٲزِیت دِنۍ کہِ أمۍ مردن کٔر مےٚ سۭتۍ یِتھ پٲٹھۍ برتاو کیازِ کہِ أمِس آسہِ ہا دفترس منٛز لڑٲے گٔمٕژ یا أمِس آسہِ ہا وتہِ کٲنٛسہِ مار دیُتمُت یا أمِس چھِ کانٛہہ فرسٹریشن بیٚیہِ چھِ یِم لۄکچہِ لۄکچہِ کتھٕ یِم زن چھِ گژھان چپاتہِ پٮ۪ٹھ چھُ پتہٕ اللہ تعالیٰ دِیِن نجات یِتھ پٲٹھۍ زن اَسہِ پٔتمہِ ہفتہٕ وُچھ کیاہ گوٚو سٲنِس ماحولس منٛز بڈگامس منٛز کیاہ گوٚو لۄکٹٕے کتھ چھِ پتہٕ بٔڑ کتھ بنان ییٚمہِ ساتہٕ وۄنۍ کٲنٛسہِ نشہٕ آسہِ نشُک عادت آسہِ ییٚلہِ وۄنۍ تٔمِس سٲری مٲلی رِسورسِز یِم زن چھِ آسان تِم چھِ ختم گژھان سُہ کوٚت گژھِ پتہٕ سُہ چھُ پتہٕ گۄڈٕ پننِس عیالس پٮ۪ٹھ زبردستی کران گۄڈٕ چھُ سُہ زنان آسان چاہے سُہ پتہٕ زنانہِ کنہٕ دوٗر منٛگہِ یا سۄنہٕ وس منٛگہِ یا تنخواہ منٛگہِ یا تٔمۍ سٕنٛز سیوِنگس کرِ استعمال گۄڈٕ چھُ تتھ پٮ۪ٹھ اثر پیٚوان پتہٕ چھُ باقین گرکٮ۪ن لُکن پٮ۪ٹھ اثر پیٚوان ییٚلہِ تٔمِس زنانہِ ہٕنٛدۍ رِسورسِز چھِ ختم گژھان پتہٕ ییٚلہِ وۄنۍ گرِکۍ تہِ چھُ ختم گژھان پتہٕ چھُ سُہ باقٕے معاشرس پٮ۪ٹھ اثر پیٚوان لہٰذا چھُ یہِ ضروٗری سانہِ خٲطرٕ کہِ یہِ چھنہٕ أکِس زنانہِ ہٕنٛز پرابلم یہِ چھنہٕ أکِس مردٕ سٕنٛز پرابلم یہِ چھِ پوٗرٕ معاشرٕچ پرابلم تہٕ اتھ خٲطرٕ چھُ اسہِ ضروٗری معاشرتی حسابے اکھ جواب کریٹ کرُن بیٚیہِ تِم رِسورسِز پننہِ کٔمنٹی پننہِ لوکل لیولہِ پٮ۪ٹھ اکھ سُہ نظام کریٹ کرُن زنانن خٲطرٕ مردن ہٕنٛدِ خٲطرٕ تہٕ خاص کر یِم زن سٲنۍ علما چھِ یِم زن سٲنۍ اِمام چھِ یہِ وَنُن کہِ قرآن کیاہ چھُ صحیح پٲٹھۍ وَنان یِمن چیٖزن پٮ۪ٹھ یہِ نہٕ کہِ کانٛہہ سینکشن دِنۍ ییٚمہِ سۭتۍ کہِ گرس منٛز زیادٕ شِدت ہیٚکہِ سپدِتھ یِم چیٖز چھِ واریاہ واریاہ ضروٗری تہٕ یہِ فٔسٹ ریسپانڈر ہیٚکہِ اِمام تہِ ٲسِتھ یہِ فٔسٹ ریسپانڈر ہیٚکہِ اکھ سوشل ؤرکر تہِ ٲسِتھ یہِ فٔسٹ ریسپانڈر ہیٚکہِ بیٚیہِ کانٛہہ تہِ ٲسِتھ ییٚمِس پٮ۪ٹھ تُہۍ اکھ ٹرسٹ چھِو کران تہٕ تِہنٛز ٹرینِنگ چھِ واریاہ ضروٗری تہٕ انشاء اللہ سٲنۍ کوٗشِش روزِ کہِ یوٗت بہٕ تیوٗت أسۍ ہیٚکو برونٛٹھس تہِ اللہ تعالیٰ سٕنٛدِ مدتہٕ سۭتۍ بیٚیہِ کینٛہہ ٹرینِنگ ورک شاپٕس کٔرِتھ یِم زن تھوڑا سا بیٚیہِ تہِ ڈیٖٹیلڈ آسن چیٖز ٲسۍ مےٚ وَنٕنۍ کہِ پٔتمہِ ہفتہٕ ییٚمہِ ساتہٕ اَسہِ پرون سیشن کوٚر تَمہِ ساتہٕ اوس اَسہِ تۄہہِ سۭتۍ وعدٕ کوٚرمُت کہِ أسۍ کرو ٹرانسلیٹ مِلت اِسلامیُک پروگرام یُس زن انگریٖزی پٲٹھۍ چھُ اردوٗوس منٛز سُہ چھُ وۄنۍ الحمدُاللہ أکِس بٲے سٕنٛدِ مدتہٕ سۭتۍ اَسہِ وۄنۍ ٹرانسلیٹ سپدومُت تہٕ سُہ گژھِ تۄہہِ سۭتۍ شیر پینڈ کہِ ذٔریعہٕ تہٕ بیٚیہِ یِتھ پٲٹھۍ زن کشملان ووٚن یُس سیلف رِفلیکشن یا یہِ وٕچھُن فٔسٹ ریسپانڈرزن ہٕنٛدِ خٲطرٕ پننہِ کِیرٕ خٲطرٕ پنُن خیال تھاونہٕ خٲطرٕ یُس زن تِمو سُہ ٹیمپلیٹُک ذِکر کوٚر سُہ تہِ کرو أسۍ تۄہہِ مہیا بیٚیہِ چھُ بیاکھ رِسورس یِم زن توصیٖف صٲب پینڈس پٮ۪ٹھ تۄہہِ سۭتۍ شیر کران سُہ چھُ یُنایٹِڈ نیشنُک رِسورس کہِ ییٚمہِ ساتہٕ أکِس ذہنی عذاب آسہِ سٹریس آسہِ یا بیٚیہِ کانٛہہ چیلنج آسہِ سُہ چھُ آلریڈی اردوٗ پٲٹھۍ ٹرانسلیٹِڈ تہٕ تمہِ خٲطرٕ کیاہ پزِ أکِس اِنسانس کرُن یا کۄس ہیلپ کُس مدد پزِ تٔمِس ژھانڈُن تاکہِ تِم روزن نہٕ تتھ عذابس منٛز ہمیشہِ شُکریہ تُہُنٛد انشاء اللہ نٔوِس
Baji, I'm sorry to cut you, but I wanted you to reflect on something else as well at the same time. Ki yus es kath karna ki ashe aksar yus es wichan chi kyunki yan peti badgamik issue go thoda chi aise variyah ak hisab se ये अख इंडिकेशन कि अस कत बर्बादी कुन छ पकान एज अ माशरे क्योंकि अक्सर छ सानन जहनन मजन ये कत आसान कि चलो यह बेकिस गसान मे तामत छुन वातान कहें तो बहुत सेफ मगर यम इशूज ना नेबर कुन ओतर बटमालनसी मजन बहुत न्यूजन मजन पारान अख नफर तम बाज़ाब्त डैगर ओनमुत तम दर फुट्रमज अंदर चामुत चूर कर्म या ब्याख ओतर बड़ वायरल गोमुत वीडियो अख लकट बेन कूर अक हिसाब सन तो तमिस बची लड़क ब्याख पे सह वत पे रटान थप करान दपान बह तुले गर्दन थोद Go number one, سٲنِس سماجس منٛز سٲنِس معاشرس منٛز چھِ نظم ضبط لوگمُت ختم گژھنہِ. دیٹ میٖنٕز کانٛہہ تہِ ہیٚکہِ کٲنٛسہِ ہُنٛد تہِ گرٕ أژِتھ. اَسہِ چھُنہٕ سُہ فرٛٮ۪ٹ یا خوف تھوٚومُت کینٛہہ. ہر اکھ اِنسان چھُ پَنُن پان بچاونٕچ کوٗشِش کران. أسۍ چھِنہٕ سُہ کلیکٹِولی سُہ ریسپانسبلٹی نِوان کہِ اَسہِ چھِ یَتھ کلادم کَرُن أتھی جایہِ پٮ۪ٹھ نتہٕ گژھِ پرابلم. أسۍ چھِنہٕ یہِ سمجھان کہِ ییٚمہِ ساتہٕ نظم ضبط یا یہِ خوف قومُک ییٚمہِ ساتہٕ یہِ ختم چھُ گژھان قوم چھُ برباد گژھان تہٕ تتھ بربٲدی کُن چھِ أسۍ پکان. یوٚتام أسۍ یِتھ کٔنۍ چھِ سونٛچان اِنفرٲدی لیولہِ پٮ۪ٹھ کہِ بہٕ چھُس ٹھیٖک میون گرٕ چھُ ٹھیٖک باقیس لٔگِن نار, توٚتامتھ لایک اگر أسۍ تٔتھی سونٛچس چھِ پکان یُس اَسہِ تھٲومٕژ چھِ, ییٚمہِ حِسابہٕ تمہِ پتہٕ سُہ قوم چھِ گژھان یتھ بربٲدی کُن سُہ بڑان چھُ پتہٕ چھُنہٕ تتھ ٹایم لگان سٲنِس گرس تام تہِ واتنس کِہینۍ تہٕ بیٚیہِ چھُ تمہِ ساتہٕ یہِ بے قابوٗ آسان گوٚمُت. سو I mean, I wanted you to reflect a little bit on that as well.
Absolutely. I think what you're talking about is called the bystander complex. And athwano is kashir person tamashbin complex. For example, in satan wati parchis pakan te ikis maji ya benesitin ka galat kam chis wachan sabdan ya ka chu galat comment karan ya kenti wachan. I'm bajai ki gas be samjawan su insan ya bakar तदोरुक तम साथ छ इंसान इत पटन तौसीफ से पनुन पान बचावनिच कोशिश करा अक लट बचो वस पान हत लट बचो वस पान सास लट बचो वस पान तिथे पछ पत ये सारी बेमार यस छ ये पूरे समाजिश बेमार बनान तो यमन चीजन हंद हेक न तदारुक गसित अगर इस सिर्फ तमाशबीन रोजो इतिस कालस न इस सारी कुनी स्टैंड्स निमो कि जनानन से तशद्दुद छ गलत ये जनानन हंद कस मर्दन ते जनानन हंद कस सारी खुद बड़ रिस्पांसिबिलिटी अमिच तिमन सान इमामन स्कॉलरन उलमान पे पेवान यम जन के हतस सासस लुकस सितन छ कथ हेकान करित हर हफ्ते लिहाजा ये वनुन कि कुरान ते हदीस छुन अमिच इज बिल्कुल ते इजाजत दिवान इस्लामस मन छन शिद्दत बिल्कुल ते इजाजत ते नबी सल्लल्लाहु अलैहि वसल्लम हंस एग्जांपल बाकियन लुकन सितन शेयर करन कि तिमो छुन पन्ने जिंदगी मज रहमतुल्लाह आलमीन ज़ाहि कैसे जनानि सितन कह शिद्दत कोरमुत. सो लिहाजा छ ये यम चीज सारी जरूरी पर्सनल लेवल पे तो अकिस माशरी लेवल पे यह हेकि तेली सोन माशर बदलित येल कि इस हर अख फर्द पन पन रिस्पांसिबिलिटी पूर करो तो ये तमाशबीन स्टेट पे पज पे इन्वॉल्व गो एज फर्स्ट रिस्पॉन्डर्स चाहे सो फर्स्ट रिस्पॉन्स आसे domestic violence खतर या सो आसे अकिस mental illness खतर या सो आसे अकिस addiction खतर मगर यह सोरी अस करन रहम सत युस जन compassion यथ वनान छ ना पज पे अल्लाह ताला छु रहीम तो करीम हिंद सिफात छ अस ते पन्निस पानस मज थोड़ा सा अनिन कि अस ते करो बाकियन सितन ये पेश यमो सो रहमत कर्म सितन तो समझनिश कोशिश करन यमो कर कथ सान एक्सपर्टो यथ अंग्रेज पे वनान डीप लिसनिंग छुनु कि बह बेहम चाय प्याला चम बह कन सितन तो पत करस बोजन हना तो पत अक कन बोज तो बे कन त्राव डीप लिसनिंग मतलब ये कि बह सोच बह समझ बह कर थोड़ा सा गौर यमन चीजन पे अगर मे कह पन प्रॉब्लम वनान गोडनेथ यह वुचन कि शुक्र खुदायस कुन कि मे मज सो कैपेसिटी कि कंस कोर पन सिर मे सत शेयर मगर तम पत क्या कर बह तमिस यम सात ब्या चीज वो यम सात कह पन सिर तुह सतन बावान तम सात तमिस वन हे त्राव यह कथा यह वन मुशरा मे सह गोमुत क्या यम चीज सठा जरूरी कि अस गोड पन पान चेकस मज थवन अगर न अस सो सलाहियत कि हेको सो फर्स्ट रिस्पॉन्डर बनित तेल बे सुन सिर तमिस वन कि बह हेक चोन सिर रचित तो या बह हेक अत कह मदद कर सन कोशिश कि कित पे करो मदद इनफरादी लेवल पे माशरती लेवल पे अगर कंस पता कत डॉक्टर कत सोशल वर्कर कत साइकोथेरेपिस्ट बह कोत हे बह मदद हेक गसित तिम तोत तान वातन तो अस कम रिसोर्सेस मज मगर यम तिम थोड़ा बहुत इस्तेमाल कर तो इंशाल्लाह अस करो कोशिश अख लिस्ट बनानुक ताकि तुह पता कि कत हेकु तुह गसित अगर कंस जरूरत यमन मसलन मज मदद जरूरत तम खतर इंशाल्लाह.
बेशक बेशक वारिया शुक्रिया बाजी ये सरसी वाश करने खतर तो मोहतरम नाजरीन उम्मीद छ कि इंशाल्लाह ये रोज अख रिसोर्स आज यीथन लुकन तामत ये वोत उम्मीद छ ये वाद बे लुकन तामत ते इंशाल्लाह तो आइंदस कुन करो तो ऐसे दिन बे मुलाकात ये कुन इश्यूस पेठन तो तामत रूजू तो अल्लाह ताला सवाल इस्ते अल्लाह ताला सवाल अस्सलाम वालेकुम